Hello and welcome to the Straits Times panel discussion on COVID-19 restrictions. When can they be eased further? I'm Salma, Khalik, Senior Health Correspondent at the Straits Times. With me today are three experts who have been closely involved in the pandemic over the past 2 years. Professor Ying is the Executive Director of the National Centre for Infectious Diseases, or COVID Central. Professor Dale Fisher, a Senior Infectious Diseases Consultant at the National University Hospital, also chairs the National Infection Prevention Control Committee. Professor Ying is the Dean of the NUS Swee Hock School of Public Health. Thank you, professors, for joining me as we look at where we are with the pandemic today and what the future holds. The Omicron wave has peaked and the number of infections are declining. Today saw the much-awaited streamlining of measures such as allowing groups of 5 visitors to homes instead of 5 visitors on any one day. However, as Finance Minister Lawrence Wong stressed last Friday, streamlining is not the easing of measures. Further easing is being held off because of the strain on the healthcare system. Essentially, what this means is that the country remains in semi-lockdown to ease the load on healthcare workers. Prof Liu is with the NCID and Prof Fisher is with the NUH. Both are clinicians. Could you tell us how stretched healthcare workers are and if this has affected patient care? Ying, would you like to start?
Well, I think as of now, we passed 2+ years of COVID-19. So you can imagine the kind of working conditions of the healthcare workers having to deal with this disease over the past 2.5 years or so. But I think the more important thing is that we don't forget, although we are in COVID-19 pandemic, we still have our regular cases. So basically, we have to take care of our regular cases as well as the frequent surges or different waves of the COVID-19. So one thing I want to stress here is that for healthcare workers, they all come with this professionalism. They want to do the best for their patients. And no matter how stretched they are, they will still put in their best. So therein go, what is stretch? They will continue to stretch themselves. But one thing I want to quickly mention here is that while they are stretching themselves, I also want to make sure that their mental health are well taken care of. And one of the key issues that we really need to consider and look after is the burnt out, because the more compassions, the more of your time being devoted to your work, to care for very ill cases, then the burnt out is going to be something that we have to handle.
Dale, would you like to add to that?
Yeah, I certainly agree with everything Ying said. There's no doubt healthcare workers are tired, and it's a commendation to MTF and the Ministry of Health, who are very connected with the ground, more so than I see in many other countries. But so it's good that they're considering the needs of the tired and weary healthcare workers. But like everyone else, they want it over. They want their lives to start returning to normal when they're not at work. And what I feel is that intrinsic in the statement about not easing measures is that there's an assumption that they've got a major contribution to controlling numbers. And I still think there's many things that could be eased, not Freedom Day, but many things that could be eased without really affecting hospitals. So that's the first thing. And I also don't think we should forget other people that are suffering. You know, children that have not had a party for 2 or 3 years, people who can't get their businesses going again because they're involved in travel and tourism. So I think good to think of health workers, thank you, but there's a lot of others as well.
So what you're saying is that easing of measures may not increase the numbers, and I think YY is going to jump in here because it's something he feels very passionately about.
So, actually, thanks, Salma. I just wanted to ask both Dale and Ying this question that has really been at the back of my mind, which is, we've heard a lot about how the hospitals are under a lot of strain right now. But in some of the conversations that I had with my healthcare colleagues, there's always this comment about how actually there are a certain percentage of the number of patients that we have in the hospital right now. They don't actually need to be there. And I'm referring to the COVID patients. That because of our protocols, that's why hospitals are admitting them into the hospitals, because the emergency departments just wanted to ease the load. That's why they made a simpler decision to admit them. And that's why it's filling up our hospitals. So to what extent do we actually think that it's our protocols that it's driving this surge rather than actually due to genuine need of these patients?
I'd like to bring back these issues which I mentioned many times before. Dealing with COVID-19, flexibility is one of the key elements. So when we were during the Delta period, the disease patterns is actually very different from today, which is Omicron. A lot of protocols were set based on Delta. And we use the Delta on Omicron, certainly there is a misfit. And these flexibilities will have to come in. In other words, we need to quickly understand how the new variant has a change characteristic, and how can we then be able to come up with something that's different. So coming back to that, I think during the earlier phase of Omicron wave, I believe that the protocol setting that cater for Delta had caused significant number of cases being admitted into the hospital while they possibly best being taken care at home. But if you look at today the majority of them, 70-80% of them are being taken care of at home, and they're doing fine. So I think the important thing here is we always have to learn. We always have to learn about COVID-19 and do the necessary things as per our understanding, rather than a very fixed protocol.
So has our protocols been updated to cater to this? Because I remember at the last MTF, it was mentioned that a significant proportion of people with COVID in the hospitals are incidental COVID cases. So they may have had a stroke or heart attack, ended up in hospital, totally asymptomatic, tested and found that they had COVID, right? So because of our protocols, they need to be isolated and can't be in, cannot be in a general cardiac ward or stroke ward. So have these, do these protocols need to be changed today?
I think at this point in time, I would say that we have encountered Omicron for a couple of months. Many of the hospitals has reorganized themselves in the best way to take care of Omicron cases. Now coming back to this, what we call incidental cases, in fact, they are COVID patients. They may come in with the conditions that is contributed by COVID with a different form of manifestations, or it could be totally something unrelated. And for the earlier part, the former that I mentioned, sometimes it's very difficult for the clinicians to tear it apart. A person can come in with a stroke. Would the stroke be due to COVID-19? Possible. Would something that these patients represents, for example, the older individuals with a lot of pre-existing comorbidities, they can present to the hospital with many different forms of clinical manifestations. Perhaps COVID-19 is also partially contributing. Therefore, it becomes very difficult for us to draw a line, whether it's COVID or not COVID. The important thing here is how do we manage them? Do we need to manage them in a single isolation facilities, or we can have a cohort isolation facilities? I think many of the hospitals now are moving into the cohort isolation facilities where the kind of care efficiency can be better provided for the patients.
I understand, while we're on the subject of protocols, I understand that quite a lot of healthcare workers are not working because they are either on SHN or because they have COVID themselves. Many of them are asymptomatic. So the question here is, if you have cohorted the patients, could asymptomatic healthcare workers work in these wards to free up non-COVID healthcare workers to work in the other wards? Then they wouldn't be so stretched. Is that a possibility we could look at? Dale, would you like to talk about that?
Yeah, there's so much I could talk about. Firstly, YY's original question about how many people are in and all the protocols. Actually, I think it's gone quite well. Compared to where we were back in August, September, when it was really a big problem. We had to change the message from COVID's deadly, we have to isolate, quarantine, all these types of things, to actually we're now in a post-vaccination era, it's much safer. But then the small number of unvaccinated people were actually contributing to a lot of severe disease. So people were reluctant, I think, to take up the home-based recovery and things like that initially, because it was quite contrary to the message up until then. Messaging is extremely important during outbreaks, as you know. So then there was the mad scamper to create the community treatment facilities and message and encourage people that this was actually, in the vast majority of cases, a mild disease. So I see a lot less people in hospital now that shouldn't be there. There's some still that are age-based, that are there just, waiting for a certain number of days to go past or whatever, or their tests to change. But most probably need to be there, and as Ying was saying, most are there for other reasons, because there's just so much COVID around at the moment. As for healthcare workers with COVID going to work, I think we need to just ask ourselves what's the end game here, and the end game, which may be in a few months, it may be in a year, I'm not sure, will be things are quite normal. That they have to return to normal. That's how humans work. But there will be some behavioural changes. I mean, people aren't going to keep doing ART or rapid tests every week or twice a week for the rest of eternity. That will eventually go, and then asymptomatic COVID will be going to work, because we don't know they're carrying COVID. So I think the behavioural change will be in symptoms. I don't think it'll be cool to go to work coughing and spluttering and sneezing anymore. I think that there just won't be tolerance for that. So I think it'll come down to symptomatic disease.
So it'll be like the flu. So if I got mild flu, nothing shows, I probably will still go to work, but if I'm sick, I stay home.
Yeah, I mean, I think in the future, if you have symptoms of an upper respiratory illness, you shouldn't be going to work. Now, that's easier said than done, because there could be an important meeting or an important trip or something like that. But that should be the objective, is that we just don't go to work if we're sick. It can be, it has to be a behavioural change. It's
right.
It's like the behavioural changes that have happened with HIV, which is obviously an endemic disease that started as outbreaks and then became a pandemic. There's people have to take measures to prevent spread.
So essentially what you're saying is, down the road, a few months, a year or so, people will, with COVID, healthcare workers with COVID, will still be working in the hospitals and treating patients. So then the question is, if they can do it a year down the line, why can't they do it today when COVID is already so widespread in Singapore? I think we are going to hit our 1 millionth infection rate, but that number probably, like Mr. Gan Kim Yong has said, is probably way below the reality, which he says could be as much as 2 or 3 times the number, which therefore means that half the population has been infected.
So I think there's 2 questions at play. What is the strategy? Do we all agree on what the end point is? And I'm not sure we've had that conversation. Is there an intention to wear masks indefinitely? I don't believe so, because I think in outbreaks things tend to eventually go back to normal, maybe with some behavioural changes. But so once we've agreed on what the end point is, then it's the steps to get there. I'm sure we're all against Freedom Day, throw off the masks and open all the nightclubs, and pretend it doesn't exist. I don't think anyone wants that, but there are things we can peel back now. I don't think anyone's ready for mask-free, huge gatherings. I don't think that's probably the last thing that should be removed. But there are things you can peel back gradually, and I think we're getting ready, because the numbers and the hospitalisations are falling.
Yes, and what do you feel about letting asymptomatic healthcare workers work?
First of all, I think, how do you know that you're asymptomatic, right? I mean, currently you can do the RRT.
No, I'm talking about current so
yeah.
right now.
Currently we are doing the RRT, but I can also assure you, many of our experience, looking at our own colleagues, in actual fact, symptomatic infection is very common. Usually, upper respiratory tract, and that is the characteristic of Omicron. It affects a lot of upper respiratory tract. So sore throat, a little bit of running nose, particularly sore throat, is one of the very prominent features.
Right.
So they are symptomatic. It takes time for maybe the antigen test to become positive because we know the sensitivity. Now I want to bring back this point because at this point I still believe that the virus is mutating and at a very high speed because there are still so many cases out there, not only in Singapore but many other parts of the world. And we allowed this opportunity for the virus to mutate. And we do not know. And nobody can predict what is the next that's going to come from COVID-19 or from SARS-CoV-2. So I think it's still very important for us. Yes, we all want to return to normal with some behavioral change. I think that is something very important for us to now think ahead as to what this COVID will make me change in my behavior to make myself safer as well as my family and the whole community. But at the same time, while we are thinking of rolling back or peeling off some of the measures, also be prepared that we are still at a very dynamic state. We may need to step up at some point depending on what is going to come in the future.
So you are saying
I think that was the most important thing to take home, is that as we peel back, the relationship between the community and the health authorities is what's kept Singapore strong so far now. There's a lot of trust, a lot of respect, a lot of faith in decisions being made. And if we peel back now because the situation's quite good, we have to be prepared to ramp back up. If there is a new variant of concern, if immunity is waning and we're finding hospitals fill up again, then if that relationship, if that conversation remains, if that understanding is there, then people should be content that day. People say, sorry, we're bringing back Trace together. You will have to do this. We are going to be isolating cases and quarantining contacts and masking up again. I think this surge, we see surges twice a year in flu. We could see it, coincide with COVID, and we could see hospitals threatened again. So I think the potential need to reverse is important.
But actually what you're saying is just as important, that we shouldn't hold back from peeling back. But we should peel back and communicate this very clearly to the people, that we are able to ease the measures now, certain measures, not all, but to bear in mind that when there is a need, we may have to bring back the measures. But we shouldn't be in a limbo state to say that we will not ease any of our measures because there's this uncertainty that's still out there. And I think this bit about communicating it very clearly to the public, what are the measures that we're able to relax now? What are the measures we are not able to relax yet? And what are the measures that, despite relaxing now, there's a real chance that we may have to bring back when we see a next wave because of a new variant and so on. And I think that communication is just as important in deciding whether to ease or not to ease.
Actually, my question is the trigger a new surge in cases, or should it be people in ICU, or should it be deaths? Because I think the ministers have been saying the top line numbers don't really mean very much nowadays.
My position on this has been consistent. I think case numbers are very misleading. I think it's like counting the cases of common cold, and we're not going to be getting, as testing drops down or people don't bother reporting their positive ART, I don't think it's particularly helpful. In fact, in some ways it can be harmful because it just scares people. But the real number is severe disease. The people in hospital, the people that require oxygen, the people in ICU, no, not deaths, severe disease. That's what I think. But the other thing would be some sentinel surveillance, which is what we do with flu. Yes. We don't count them all. We just get the number of acute respiratory illness presentations to primary care, and what percentage of those are COVID, because we might test 1 in 100 or something.
All right. Actually, you're talking about oxygen, hospitalization, ICU. Today, the number of people in ICU with COVID is about 30 plus. The total number in hospitals is about 1,003, of which I think you people have already said not all of them might require, a small percentage may not really require hospitalization except for their age. So the numbers really look very good. And in fact, we know that Omicron peaked about February 22nd. We had more than 26,000 infections then, and the numbers have come down. The weekly reproduction rate has gone to 0.8 yesterday. So it's been more than 3 weeks. Isn't it time, in your opinion, for us to now start peeling back these measures that have been in place? And if it is, which measures do you think should be peeled back? Or Yisin, don't you think we should start peeling back now?
Well, I think the task force already make the decisions. I think it was
That's a political decision. So medically, as infectious diseases experts, what's your take on this?
Well, my take is that we truly need to monitor the situations very closely. And what are the key parameters you are looking at, right? Because we're now looking a lot, focusing on the healthcare. So what is the healthcare pressure at this point in time? Is the healthcare pressure solely just from COVID-19? Or the healthcare over the past 2+ years that we need to pick up and be able to manage many of the non-COVID cases? And many of the cases could have been delayed a little bit because of COVID situations. And now is the time for us to be able to pick them up. So we don't just look at the pressure that is being put on the entire healthcare system by COVID-19. We have to look at the totality, which means that the critical services currently within the healthcare system, how can we cater to all the needy patients, regardless COVID-19 or not? And I also believe that the recovery phase, right, as we see the trending of COVID-19 coming down, and that is not really the time for us to relax the healthcare services. In fact, we need to even ramp up, because now is the time for us to go back to many of the regular cases that are non-COVID, to be able to now provide them with adequate care and good care as we move. So I think whether or not we should relax is really a balancing that we have to do, right? Balancing the healthcare system plus the needs of many other sectors. But I think healthcare service to me is still the most essential and critical. And this is the piece that we really have to watch very closely.
So you're suggesting that if we were to relax measures now, the number of COVID cases will again overwhelm the system, so that people with regular medical needs may again be pushed to the back burner?
It may not overwhelm the medical system, but I think we do have to anticipate cases may come up. The number of cases may come up, and we have to find a balance where how are we going to re-resource the healthcare to be able to cater for both.
Well, maybe I could jump in here a little bit, because Salma, earlier on you asked about the fact that about 2-3 weeks ago we saw the peak in the number of cases reported. But actually, from the epidemiological standpoint, there's always a lag of about 2 weeks for the situation in the hospital to catch up with the peak in case number reporting. So, in fact, last week and this week, Dale and Yisin, correct me if I'm not wrong, would probably be the busiest period in the hospitals because of the peak that we saw that you mentioned on the 22nd or the week of the 22nd of February.
3 weeks ago.
Yeah, so last week and this week, actually, the hospitals will see the surge or the peak in the number of hospitalizations. So like what Yisin has mentioned, is the healthcare services at a state that we feel we're comfortable to relax the measures? I think that's where we would have to look at, by relaxing now, certainly the number of cases in the community will come back up. That's for sure, because from an infectious disease standpoint, the moment you start to allow more people to mingle together, there's more interactions, case numbers will go up. But what does that mean for the healthcare services? I think that's the part that we will have to look into very carefully. And earlier on, when we start to talk about the number of cases that require hospital treatment, the severe disease cases, and I was just referring to the statistics that the Ministry of Health put up on the internet. The fully vaccinated plus boosted people continue to remain at a 21-fold protection against anyone that is unvaccinated. So my prediction actually is that 2022, we will be able to ease quite a lot of the measures that Dale talked about. But 2022 will be a year of the pandemic for the unvaccinated, because the unvaccinated people, if they have not been infected yet, there's a very high risk that they'll be infected, and these are the ones that will suffer badly when infected.
Listen, is that your experience?
Maybe I bring back this point about the physiology. That is, if you look at COVID-19, the majority of the severe cases, or people get hit most severely, in fact, are the older individuals. So if you look at currently, more than half of the admissions into our place are all age 60 and above. Maybe 60, 70% of them age 70 and above. So we know that this particular segment of the populations, despite having full vaccination, 2 doses, or being boosted with the 3rd dose, they remain a vulnerable populations, and many of them with chronic conditions. Now, if you are in that stage, in that age, with that kind of chronic conditions, any acute infections is able to, in fact, hit you and bring you down, and they can be acutely ill. So we do see many of all these cases, acutely ill, coming into the hospital, and they do need treatment because either the blood pressure dropped or they have abnormal blood test parameters that we need to give them the necessary treatment. Now, once you are into that age, 70, 80 or 90 years old with an acute infections, they will suffer acute deteriorations or acute deconditioning. And they will need much longer time for them to recover to their pre-morbid states. And that is the pressure. And that pressure is basically being felt by the healthcare system of the aging populations. And so when we design some of all these healthcare systems to be able to cope with this, we have to take into considerations the change in our demographic in Singapore.
So you're saying if you're over 60 years old, it doesn't matter whether you're fully vaccinated or boosted, your risk is very high the moment you're exposed to COVID?
Your risk is higher compared to the younger one. The older you are, the higher the risk. The more of the chronic conditions, the higher the risk. Vaccines will reduce the risk, but it cannot completely take away that risk.
But this risk will be there forever and ever. Are we going to keep these measures forever and ever to protect this group of people?
I think patients who require treatment, we should give them the best that we can.
No, treatment is fine. I'm talking about measures to protect this elderly group of people.
This elderly group of people that become ill from acute conditions will have to use healthcare services. And that's exactly where we are today. We have to take care of them because they're acutely ill,
yes,
and they can recover. And we just need to give them a little bit of the support and push and a bit of time for them to recover.
Right. Dale?
Yeah, a couple of things. So firstly, I think this is the future, that as we return to normal, the people that are vulnerable that Yisin's talking about, there's no doubt they exist. They will get COVID, just as people get flu and get serious illness. Vaccine, we knew from the trials that they weren't 100% effective. So we always expected this, and part of the future needs to be how do we protect those individuals without impacting on the whole of society. So that small number of people, everyone has to do all the measures that we're now very familiar with. The questions you're asking also imply that these measures are critically important to protect hospitals. And I would argue that things like the vaccine travel lanes, all the testing around that when you've got 15,000 cases, 20,000 cases a day, the small number that may come in across the border, now, it's now more of an expensive inconvenience and a deterrent to travel, and it makes it hard on people's whose livelihoods rely on that. I can't accept that wearing a mask when I take my dog for a walk, I can't accept that that's protecting hospitals. So I think outdoor masks would be an easy one to go. I think the social needs of people aren't really going to be satisfied with 5 people at your home at one time, and I'm not sure having 10 is really going to destroy hospitals. 10 vaccinated people that are all together, is that really going to? So these are the measures. This is why I'm not saying throw everything away, but I'm saying travel easing will create livelihoods, and that's everyone, whether you're a bus operator or a translator or what. And just the psyche of people, I think, will benefit a lot from not having to wear a mask when you're outside. being allowed to have 10 people around to your house for a birthday or for a Christmas or Chinese New Year.
Maybe I just add
Right.
on what Del had just mentioned. I think we need to understand where would be the situations that give us a higher risk of transmission, and what can we do as the general populations to be able to give a layer of protections to the vulnerable. Then I would say that it has ample evidence right now that it is a droplet and airborne pathogens. So what will be the conditions that is most at risk? It will be when the mask is down, when we are talking, eating, talking, singing. Those are the activities in actual fact will expel a lot of all this aerosol. So what would be the conditions where this thing can happen? First of all, crowded area, dining together, and don't forget home transmissions. And it's very common to see family with the family cluster with COVID-19. And why? Because that is the relaxed period of our life. We take down our masks, we interact, we talk to one another. Now I want to bring back this is that in local situation in Singapore, 3-tier family is very common. So if you allow large number of young individuals with very mild disease being infected, invariably the vulnerable will be infected. I think we just have to remember all this point. And coming back to what Dale mentioned earlier on, it becomes what we can understand to change our behavior, this behavioral modifications that we truly need to be able to inculcate into the entire populations. Not for just now for COVID-19, but I think it will gain a long way in the future as well with regards to respiratory viruses.
Right. So it looks like you agree with some of what Dale said and not with others. So VDS and walking your dog should be fine, but increasing
Well, it depends on what you think the end game is. I think the end game is relative normality, because it'll be a circulating virus, we're getting exposed, we protect the vulnerable. I think that's just how it has to be. We're a species that needs to socialise. We're a species that needs to work to provide for our families and to provide for our recreation. So we can't, so that's why I said earlier, it's about the strategy. What is the end game and how are we going to get there? Is our end game that we're never going to let 3 tiers of family mix? Of course not. How are we going to do that? How are we going to move to that?
It's the timing issues.
Yeah.
Right. This timing issue, you're absolutely correct. And I wanted to bring out this point because people are increasingly asking if the delay in easing measures is being fair to them, right? Many livelihoods have been affected, are still being affected today. So at this point, it's very different from, say, last year when the risk was much higher. Now the risk is very much lower, but children are still missing out on their childhood. Dale says we are human beings, we are social animals. People need that socializing. So by delaying, every added day of delay, is it being fair to the rest of the population? Yes, we must protect the vulnerable. Are there other ways we can go about protecting this group of vulnerable? Why? What do you think? How do we protect this? Can the vulnerable themselves, for example, take precautions when they meet their grandchildren, when if they're at high risk, and let the rest of society carry on life as normal?
A few points there. I think the first point is, Salma, you ask about can we at some point in time take certain measures to protect the vulnerable, but yet not disadvantage or not biased our measures against the whole of society. And I actually think that as a society, Singapore, we have been very good at counting the cost of deaths, of diseases, of the impact to the economy. But we haven't been very good at counting what you mentioned, the cost of missed opportunities. My son having missed out on attending the National Day Parade when he was primary 5. The
social impact.
The inability to just interact in camps again for children. I think for those softer measures, we're not great at calculating the cost, but there is still a cost. Right now, we start to talk about the mental impact to the mental wellness. So that's the first point, that for every day that we keep our measures, there is an impact not just to the economy, but also to the softer side of our lives, like what Dale, you have mentioned. Yes, we do minimize some of these infections from happening. But actually, that brings me to the second point, that I think that, Dale, you talk about the end game. Based on my limited knowledge on infectious diseases, for humans to cope with many of such infections, the end game often has to be a mixture of vaccination, which provides that immunological protection, but at the same time, also the immunity that one gets from natural exposure. And that's when you develop some of this immunological memory, that subsequent exposures, perhaps it wouldn't hit you just as hard. And this is where I look to Dale and Eason to correct me if I'm wrong. And if we do think that we need to have that immunity from natural exposure, then actually right now with Omicron, where we sense that it's not as severe as Delta, is this actually the right time to let our people be naturally exposed? But I remember what Professor David Lai says, that we shouldn't deliberately organize COVID parties. But should we now still have all these measures in place with the intention to minimize infections? I don't actually think that we need to do that anymore. And when we talk about that behavior change, one of the real behavior change that I always feel is that individuals need to take that personal responsibility that if I'm going to visit my parents, my elderly grandmother, or if I'm going to have meals or gatherings with an elderly person, I take that personal responsibility. I test myself before I go. Right now, perhaps we need to go through this routine testing before we meet up with the vulnerable people, because COVID-19 is still quite prevalent in the country, and immunologically, we are still quite naive in the sense that our immune system hasn't been built up. But perhaps when they'll talk about what's going to happen 1 year later, 2 years later, we may still see returning waves of COVID hitting our society. But perhaps with every wave, the number of people that will experience some of these severe outcomes is going to be lesser and lesser, just because our body has gotten used to it.
That would be the ideal, right? We always talk about virals will attenuate over a period of time. So coming back to SARS-CoV-2, have we learned that whether this virus will behave the way that we want the virus to behave, that it will attenuate itself? We don't know. So I think the reason why we are all here talking about this is because we are still living in a period of uncertainty. And you need to find a very fine balance. How do you balance in the period of uncertainty? And what if you are wrong? Either way, you are wrong that you didn't make the right choice, or you're wrong that you make a wrong choice. But whatever it is, I think we do need to look into the various aspects to be able to look into where can we find this balancing point. But the way we think that we have able to estimate or judge that this could be the best balancing point, it may not turn out to be the real one, because we are still in the area of uncertainty. But whatever the case, I think it's very important for us to continue to be able to monitor the situations and have something still in your pockets that, should it turns out not the way that you predict, you have a contingency plan. You can still hold on to the situations. Now, I want to come back to this, which is timing. The reason why I want to talk about this is because I was once challenged by people during Delta. Why don't we get the young people out there to be exposed to Delta? Because, even for Delta, the younger people tend to be able to overcome the illness quite reasonably well. Had we done that, we will suffer a lot, because the young people will be contributing to a chain of transmissions. And you will have the vulnerable people that will be affected very badly. And in Omicron is completely changed in a way that they can evade the immune system. Whether you had the Delta or not, or even within the same sublineage, you can be reinfected. So in other words, they're still at risk, so to speak. So I think timing is very important. Had I known that COVID is going to behave like that, then I would say certainly no at that point in time to do that, right? So now we are in Omicron. Do we know what next? We don't. So we can make the best decision at the point in time, but just have to bear in mind that the best decisions may turn out to be very right, it can turn out to be very wrong.
Well, there's this new variant called Deltacron that's emerged in Europe, very few numbers, and at the moment it doesn't seem to be a problem. But you're saying that if that does, for example, become a problem, we should maintain our current measures?
I think we have to look at, first of all, what this new variant is going to come. We don't know. The recombinations of Delta and Omicron. Now, it is a real recombination because it's been taken from a virus isolates. So it is a real thing. Although the number is very small at this point in time, it may fizzle out or it may become a problem. We just don't know. We are still very uncertain of the whole situations. Now, while we are focusing on this Delta plus Omicron, maybe something else, we don't know. So just have to have a very open mind because we are still very uncertain at this juncture.
I'm happy with an open mind. I'm just worried that this current situation will be prolonged because there will always be the possibility of new variants coming up. So we as a nation will have to make a decision sooner or later. Can I just go historically back and see where COVID has happened and the increasing number of deaths we've been seeing recently, which has been of concern? Singapore has had 3 COVID-19 waves. The first affected largely foreign workers residing in dormitories in April to June 2020. There was a second, larger wave in October and November last year, and the current huge Omicron wave. Deaths started to soar with the second and third waves. From the start of the pandemic here in January 2020 till the end of September 2021, a total of 95 people had died from the disease. Since then, though, the bulk of the population has been vaccinated and many have also received booster shots. Over 1,000 more people have died. Could you explain why this was so?
So I think the graph is actually very important to tell us a few things. So first of all is your cumulative total or your base, right? So if you look at your earlier wave, the cumulative total number of people infected during Delta is so much lower than today in Omicron. Just within a very short period, we see hundreds of cases. So it is the base. And therefore, you look at what is the tips. I did a very quick calculations recently looking at the different period, Delta periods versus the Omicron period, and looking at the death and looking at the denominator. In fact, Delta is still 5 to 6-fold higher in mortality compared to Omicron. So we can't just look at the absolute number. We have to look at the denominator as well. So we are very sure that at this point in time, with the vaccine, we are seeing less of the Omicron mortality.
Right. So in other words, Omicron is milder, but it is still killing people. And this is something that we have to accept in the future, because when we say that something is endemic, it doesn't mean that there are no casualties.
So the other point to factor in is the population that was infected. So the first wave in the foreign worker dormitories, obviously they're much younger, healthier than the sort of norm of the population. So the despite the very large number of cases, the death rate was distorted. It was low because of that population. When we started to see it come up around September last year, you remember it was August we started easing restrictions. We had very good vaccination rates, but I think probably what we didn't factor in hard enough was even if there's 90% vaccination rates, that small percentage of people is still a large number of people. There's still thousands of people that were unvaccinated. And the group that was overrepresented was actually the seniors. So there was an unusual hesitancy in the senior population, and the government was quite quick to this. There were a lot of proactive efforts, including even door knocking and promotional videos and things like this. And of course, Hong Kong saw the same thing. So I think that's a cultural nuance of, and I think there were 4 reasons. One was I'll have it later. Another is that sort of fatalistic, I'm old, I'll see what happens. Another is, I've got heart problems, I don't want it to disturb that. So there there were reasons, but nonetheless, of all the age groups, they were actually the lowest. So that's why we saw a death rate. The death rates were remarkably overrepresented in the unvaccinated. You know, you look at all those charts that we look at every day, whether it's on oxygen, on in ICU and deaths. The section that was the unvaccinated, even though it's only 5 or 10% of the population, was still more than 50% of all the cases. So I think that's why we saw death rates high there, but low in other waves.
So YY's favourite phrase, "it's a pandemic of the unvaccinated," is still relevant today.
Yeah, I'm sure Ying as well. We still see people severely ill in ICU that chose not to get vaccinated.
So then the question is, would a second booster help cut the number of deaths, especially among older people? Several countries have already offered that. Israel, Britain and Denmark are giving it to people at risk. Hungary is giving it to everyone in the country. Ying, is it something Singapore should consider for our vulnerable population?
Well, I'm very sure Ministry of Health is looking very closely the local data to make the decisions. They are monitoring very closely in terms of the vaccine effectiveness in preventing infections, as well as particularly preventing severe disease. So I don't deny that while looking at all this data, Ministry of Health may one day decide that it is time for us to provide another dose, particularly to the highly vulnerable one. Many of the countries are using 80 as a cutoff point. Yeah. Coming back to this death, since we are talking so much about that, I just want to mention Singapore is among very few countries, and the data has been just recently published in Lancet, looking at the mortality across the globe, I think 70 over countries. Singapore is one of those very few countries that had negative excess death compared to many other countries. It just means that somehow, because of the reduction in the social interactions and more of the restrictions, we cut down significantly on many of the acute infectious conditions. Things like influenza basically is rock bottom in Singapore and in many parts of the world. I want to bring this back is just for people to understand that as we open up, as we increase the interactions, we don't just have to focus on COVID-19. We now have to look into the broader scope, that there are many acute respiratory viruses out there, and we have to monitor not only COVID-19, but the whole range, and be able to understand how the population is facing different kind of situations as we go. Don't forget, influenza has been very quiet for 2 years, and we don't know the next round how things will be like.
So Ying, are you saying that the last 2 years we've had fewer people die, and that probably largely comes from the lack of influenza deaths, which usually kills 600 to 800 people every year? So are you suggesting that maybe we continue with our mask wearing and limiting the number of people, because that not only reduces the number of COVID deaths, it also reduces the number of influenza deaths?
Salma, you're putting me at the extreme. Yeah. In life, there is never an extreme.
That's
but
true.
I think this is an important point to bring up, because in the past 2 years, Singapore, our death rates from COVID-19 have been very low, in part because we have put in place very strict measures in the society to really minimize interactions. And Ying, you talk about how we have negative excess death, and that came about because we were not seeing some of the deaths that would have occurred due to interactions that result in influenza or pneumonia. But we can continue to have negative excess deaths if we continue to have a lot of these restrictions that we put in place to minimize interactions, because when humans don't interact as much, definitely we cut down on influenza. But this is where I come back to the bit about how we are very good at quantifying the cost when it comes to deaths, diseases, and the economy. But there will be an impact to the mental well-being, to the development of people, that actually those costs, we haven't really monetized it equivalently the way that we've been doing it for diseases and deaths. And I think if we start to really calculate some of this, we would realize that actually the impact of some of the measures that we put in place is going to be just as significant, if not more. And the question therefore is, if I paraphrase what Salma is asking, is at which stage do we think that we should ease up on some of our social measures, thereby we will incur some of this cost due to influenza, due to COVID cases that results in diseases and deaths. But we believe that the overall benefit to individuals, to society, will actually outweigh some of the impact from opening.
So there's a lot of work for School of Public Health, because I think this is seriously is an important area for us to be able to focus on. But I just want to mention here that don't just look at number and interpret just the number, because now we may be also facing another phenomena, which is displacements of the mortality that can be experienced by Singapore, can be experienced by other countries. Just give you an example. If you have a very high mortality rate because of COVID-19, part of your vulnerable populations could have already succumbed to COVID-19, and therefore you have less. So you would think that you are in a better shape, but Singapore may be just the opposite, because we had negative excess mortality. So I think when we look at data, we need to bring it back into the context.
It's always been, ever since the pandemic started, it's always been a balance between the health and the social and the economic benefits. And we needed a lot of blunt measures. We needed some aggressive action, because in the first year, the health impact was extremely dangerous. Now getting COVID doesn't have the same ramifications. It's not as severe, 99.7 are asymptomatic and mild %. So I think we do have to change. Yisin is exactly right. If with all these measures, flu went down, acute respiratory illness went down, hand, foot and mouth disease went down, gastrointestinal illnesses went down. Once you stop people interacting, you stop infectious diseases. I'm sure sexually transmitted diseases went down, because of less interaction. But as YY was saying, this is not how we work. We've just had the report recently on childhood weight gain during the pandemic. We know mental health issues, social skills. How are they being developed in our kids? So we have to accept the type of species that we are, and factor in everything.
Right, so we know that there is a cost and delay. Would the reopening of our country, every day's delay, would that, what sort of impact would that have, given that countries globally and in the region have already been opening up? So would Singapore's economy, for example, lag all the others, and would it be more difficult for us to catch up in future? YY, would you like to take that?
Actually, I was just having a conversation with Dale before we started recording on this, which is, if we look at what's happening regionally, in terms of what's happening in Thailand, Thailand opened up 1st of February to all countries. If you're vaccinated, you could come into Thailand. Malaysia is doing that for 1st April. Philippines did that 10th February. Australia did that 21st February. But to be honest, if we look at what is necessary to make use of all that travel opportunities, there's still a lot of testing that's required. And many of these countries that I talk about, they require you to be PCR tested before you fly over. So if I want to plan a trip, say to Bali, for a 4-day trip, I actually need to go through 4 PCR tests, 2 going over, 2 coming back. And I actually think that
the threat of what if you're positive and asymptomatic,
and you can't come back,
all your plans are messed up.
Yeah. So I think we have to look at it in totality to say that let's not be distracted by some of these countries announcing their plans to open up, but to look at the reality that despite their announcement, are people really traveling as much to those countries? I think there will be people who would be willing to incur the cost of PCR test to have a 3 or 4 days trip in Bali. I know some of my colleagues will. But in terms of the actual opening, I think Singapore, we need to look into what are our plans, not just to open to all countries that for fully vaccinated people to come in, but also at the same time, to what extent are we confident enough now to relax some of our requirements on whether it's PCR test or ART test before flying. And I think...
Or nothing.
Or nothing. If I travel to UK right now, I don't have to be tested when I enter the United Kingdom, but I need to be tested when I come back because Singapore requires that. So I think definitely Singapore, we need to maintain our strategic advantage as an air hub status because we don't want to lose out to our neighbours, which is often a real risk. In that sense, we need to not just look into what is the timeline to ease our travel arrangements, our VTLs. In fact, I'm of the opinion that we don't need to talk about VTLs anymore, but rather if anyone is fully vaccinated, we allow them into Singapore. But at the same time, how do we also look into easing some of these requirements of testing? And do we think that by easing the requirements of testing, will we now see a surge that will drive hospitalizations? Or do we actually think that the number of imported cases, despite it not being zero, is going to be a small fraction compared to what we are seeing in Singapore anyway?
Especially when you weigh up the social and economic benefits of freeing up this travel,
yes,
which has a value.
So could we have perhaps an age, somebody who's above 60 years old, for example, may require a PCR test, but those who are vaccinated and below 60 may not require when they come in, doesn't work?
Not 60.
At what age?
At what age, Dale? At what age?
Infections does not respect your age.
Exactly.
No, but younger people are not likely to be as sick, so they will not probably unlikely to use up our healthcare system.
But this is why I was saying they have to be vaccinated.
No, we are talking about all vaccinated people, but you want maybe PCR tests for the older people coming in? No? Remove it altogether?
They might be more likely to get severe disease than a younger person, but that doesn't make it likely.
Right.
And to penalise them with all this, you have your 60th birthday and suddenly you can't, you have to have tests. Oh, damn, I'm positive, I can't go.
I actually don't think that we need to have testing that is so strict at this point in time for PCR into Singapore or even out to other countries. We can't control what other countries require, but at least within Singapore, the question is, do the PCR tests still serve a purpose? Because I think that this requirement of PCR tests was put in place when Singapore was trying to maintain very tightly a zero COVID strategy and really trying to minimize infections coming into the country.
Yeah, because then they mattered, because we were zero inside the country,
yes,
and 10 coming in and going and mixing could have caused a problem. So it's a different strategy, as you say. What is the purpose now? Are we trying to protect hospitals?
Could I do a quick survey? How many of you think we can actually do away with entry PCR tests for visitors? Dale?
Yes.
Do away. Yisin?
Well, I'm always the cautious one. I would say that, at this point in time, perhaps yes, because Singapore, we do have a significant number or high incidence of COVID-19. So I would be sitting on the cautious side that, the decisions we have to be made depend on global situations and also depends on the local situations. Currently, maybe yes, but one day, I'm very sure Singapore with better controls, we're in a better positions, but you cannot be sure that the whole world will be moving at the same step.
Why? What's your take?
I don't think we need PCR tests.
Today, if I, take a flight, I would definitely put on my mask.
Oh, I agree.
No problem there. Although
I think
planes are very well ventilated.
That's been a really interesting discussion. We've gone from COVID to travel to PCR tests and mask wearing. Before I end this session, could I ask all the three panelists if they have anything else they would like to add? Ladies first. Yisin, would you like to start?
Well, I would say that this is truly not a time for us to have a COVID-19 party. I think it's always good to remember that the longer term impact of COVID-19 is still quite uncertain at this point in time. Do your best protecting yourself from having the infections and protect the people around you.
Dale?
I think my message is about strategy and coming up with what is the end game. And I think the end game needs to be fairly normal, but with a strong communications with the public, with the community, two-way, so that we understand community concerns and can keep them informed. And with that relationship, we can always reverse. So I think we do need the capacity to deal with future surges in hospital admissions and say, okay, we need to go back on. And I think if the community is functioning as one, if you like, then people would go, yeah, we know the drill. Still got the masks, we'll put them back on. I'll cancel next week's party because we know we just have to rein it in for a few months. And I think that strong relationship is critical, and that's the new normal, not just get rid of everything and it's a one-way street.
And why?
I think if we look at what's likely to be the long-term strategy towards coping with COVID-19, it's that right now, because we have had quite a lot of infections happening in Singapore over the past 2 months, we've had a lot of people boosted. There's a degree of resistance or protection right now in the population against COVID-19. But would this remain indefinitely? I don't actually think so. I think at some point in time, we will lose that degree of population protection, and therefore we may need to come back to whether it is a booster, a fourth booster or fifth booster or annual booster, or we may start to see again an outbreak happening. So I expect that we will see recurrent waves of COVID-19 happening in future. But that means that as a country, we don't remain in a limbo state, whether holding on to restrictions or holding off restrictions completely, but we remain in a dynamic state, like what Ying talked about, that if there is going to be an outbreak happening again, we look at what are the measures that need to be put in place. The bit about behavioral change that Dale highlighted a lot, it's going to be absolutely necessary. That in future, if I feel that I'm actually not feeling very well, I have a cold, I have a running nose, I actually stay at home. I call in, I tell my boss that I'm not going to work, and that is going to build...
Or you wear a mask if it's critical.
Yes, I wear a mask, because I think that is going to be essential to build up that overall population resilience against COVID-19, because I don't see that we can remain in a limbo state that we hold so tightly to our measures to the point that we don't ease up.
Thank you very much, YY, Ying, Dale. We need to wrap up the session now, but do keep abreast with the latest on the coronavirus in Singapore and around the world at straitstimes.com. I'm Salma, Khalik. Goodbye and stay safe.